Welcome back. In today's video, we're going to be talking about duloxetine or Cymbalta. And this is in response to a few of you who've asked me to make a video specifically about this medication. So without further ado, let's get into it. So number one, what is Cymbalta or duloxetine? Well, Cymbalta is an SNRI, a serotonin norepinephrine reuptake inhibitor. And so this is going to increase both serotonin and norepinephrine. However, remember that in the prefrontal cortex, dopamine has a greater affinity for norepinephrine transport systems. And so when you block that, you actually inadvertently increase dopamine in the prefrontal cortex. Also, duloxetine can weakly block dopamine reuptake, so it can actually increase dopamine in other areas of the brain. So what is duloxetine or Cymbalta used for? Well, Cymbalta or duloxetine was FDA approved in 2004. And the FDA uses for this medication are major depressive disorder, generalized anxiety disorder, diabetic peripheral neuropathic pain, fibromyalgia, and chronic musculoskeletal pain. So some off-label uses for duloxetine include stress urinary incontinence, neuropathic pain or generalized neuropathic pain or chronic pain, and other anxiety disorders. So how long does duloxetine or Cymbalta take to work? Well, first we have to consider the therapeutic dosages. So therapeutic dosage ranges of duloxetine or Cymbalta are going to be anywhere from 40 to 60 milligrams. And this is typically in divided doses, so taking it twice a day. However, you can take a full dose once a day, typically at night if it causes somnolence. Now, the max dose would be 120 milligrams. And if you're looking at treating neuropathic pain and you're at a therapeutic dose, it's typically going to take 1 week to start to treat that pain effectively. Now, if you're looking at treatment for depression or anxiety, it's going to take anywhere from 2 to 4 weeks at a therapeutic dose. Now, some patients won't see results for 6 to 8 weeks. So if that's you and you're on this medication and it's been 8 weeks and you're at a therapeutic dose and you're not seeing any improvement, then you may want to talk to your provider about switching medications. So number 4. Is duloxetine or Cymbalta addicting? Well, no, it's not addicting. And as I described in the video on antidepressants and addiction, what occurs is neuroadaptation. And this neuroadaptation that occurs can actually cause an abstinence or withdrawal syndrome. So, the other thing to consider with duloxetine is that it has a short half-life of 12 hours. And so duloxetine can be difficult to come off of. So if you're going to come off of this medication and you've been taking it for more than a month or two, then you're going to want to taper off of it very slowly under the direction of your provider. And so number 5, what are those side effects? Well, of course, all medications have side effects, and duloxetine or Cymbalta is no different. So when we're talking about side effects, first we're going to talk about the black box warning that all antidepressants have, which is it may cause increased risk of suicidal ideation, and this is predominantly noted in the younger adult population up to 24 years old. So when we're talking about common side effects greater than 10%, will include nausea, dry mouth, drowsiness, fatigue, headaches, and decreased appetite. So less common side effects seen in less than 10% of patients are going to be insomnia, dizziness, agitation, anxiety, sexual dysfunction, flushing, diaphoresis, constipation and or diarrhea, or weight gain. Now, there are also rare but dangerous side effects that you need to be aware of when it comes to duloxetine or Cymbalta. So you may get orthostatic hypotension, and this is where you stand up and your blood pressure drops significantly. So if you're experiencing that, this may typically occur in the morning, first thing when you get out of bed, and one way to help prevent that is to slowly get out of bed, sit at the side of the bed, and dangle your feet a little bit to get the circulation going. Another rare but dangerous side effect can be seizures. Also, Stevens-Johnson syndrome, which is that rash that I talked about in several other videos, but that can occur very rarely with this medication. So if you have a rash, then you're going to want to make sure to report that to your provider. Another rare but dangerous side effect is hyponatremia, which is low sodium count. So if you start having symptoms of confusion, weakness, and lethargy, you might want to get your labs checked. Also, elevated liver enzymes, which can lead to hepatotoxicity or liver toxicity, can occur or have been reported. Again, this is very rare, but if you start to have jaundice, which is yellow-toned skin, or even jaundice or yellow-toned eyes, you may want to consider getting your liver enzymes checked. However, what I recommend is making sure that you're getting all of your blood levels checked at least twice a year when you're taking psychotropic medications. And the last dangerous side effect that we'll talk about is angle closure glaucoma. So if you're someone who has untreated anatomically narrow angles, you probably want to avoid duloxetine or Cymbalta because it can increase your risk for angle closure glaucoma. And so now number 6, what about those drug interactions? Cymbalta or duloxetine is metabolized primarily by the CYP450 2D6 and 1A2. It's also an inhibitor of these substrates, but more moderately on the 2D6. So you're going to want to make sure to be aware of some inhibitors and inducers of these substrates. Now, also because Cymbalta is itself an inhibitor of 2D6, it can impact other medications on that substrate. So things like codeine, beta blockers, and even a medication called atomoxetine, which is another type of antidepressant, could be inhibited by Cymbalta and require dosage changes. Now, cigarette smoking is actually an inducer of the 1A2, and because duloxetine is partly metabolized by that 1A2 substrate, so cigarette smoking can induce the metabolism of duloxetine or Cymbalta, and so therefore you would require higher dosages of duloxetine or Cymbalta if you are a cigarette smoker, and so you would require dosages much higher than therapeutic dosages for duloxetine or Cymbalta to work for you. Now also consider if you quit smoking, you're going to want to make sure to reduce that dose back to a regular therapeutic dose. Also, when it comes to drug interactions, just like with many of the antidepressants, you want to avoid the MAOIs or the monoamine oxidase inhibitors because they have a great risk of hypertensive crisis, but a greater risk of serotonin syndrome when combined with antidepressants. So you want to stay away and avoid the concomitant use of MAOIs with other antidepressants, including duloxetine or Cymbalta. Now, some MAOIs that aren't antidepressants include the antibiotic Linezolid and a medication treatment for methemoglobinemia, which is the methylene blue intravenous treatment. That is also an MAOI. So if you're taking an antidepressant like duloxetine or Cymbalta, you definitely want to avoid those. So you also want to make sure to avoid things like NSAIDs, like ibuprofen or aspirin, and other blood thinners like Coumadin, because serotonin aggregates the platelets and can cause less platelet binding. Medications that affect serotonin have an increased risk for bleeding. Now, this doesn't mean that if you take one dose of ibuprofen that you're going to be at this increased risk. What I'm referring to is people who take this on a regular basis. So if you're taking ibuprofen every single day, or aspirin every single day, or a blood thinner like Coumadin every single day, then you're going to be at an increased risk for bleeding, and you're going to want to monitor for that bleeding, looking to see if you have bruises or any blood coming out of any of your orifices, okay? The other thing you want to avoid is alcohol. And the reason why you want to avoid alcohol, clearly because it's a depressant, and so it's doing the opposite of an antidepressant, but also because it can increase those CNS depressive effects, so the central nervous system depressant effects of Cymbalta, which some people get and experience, such as somnolence. It can actually increase that effect. So that's why you want to definitely avoid alcohol. And so what are my final thoughts on duloxetine or Cymbalta? So duloxetine or Cymbalta is very good for patients who have depression with physical symptoms, such as neuropathic pain or chronic pain, or even patients with fibromyalgia, because it's very common for patients who have fibromyalgia to have depression. It's also a very good option for patients who do not respond to those SSRIs or other antidepressants. It also has a less problem of increasing blood pressure than other SNRIs. So for instance, like venlafaxine is known for increasing the systolic blood pressure. However, with duloxetine, that's minimized. Even with elderly patients, we don't see a large increase in that systolic blood pressure. The other thing with duloxetine to consider is that even though you can take it once a day, at night, primarily if patients are having issues with somnolence, it's best to dose it twice a day. Dosing it twice a day is where I see that it's most effective. Remember, it has that short half-life of 12 hours. So dosing it twice a day would be ideal. So if you're someone who's having somnolence as a result of Cymbalta and you're taking your complete dose at night and it's not as effective, you may want to consider taking a very low dose, say 20 milligrams during the day, and then taking the larger dose at night. That can help avoid the somnolence, and also consider that that side effect of somnolence is usually transient, meaning after 1 to 2 weeks of taking this medication, the somnolence typically goes away as your body adjusts to it. So that's it. That is my overview on duloxetine or Cymbalta. Did you find it very useful? If you did, go ahead and give this video a like, and if you have any questions, drop them down in the comment section below. If there are other medications that you would like me to cover, go ahead and drop those ideas down in the comment section as well. And as always, I thank you for watching, and I wish you well on your mental health care journey, and I'll look forward to seeing you next week.